So normal lungs, they look like it's gonna be a couple years, so you see a fresh one. We'll try to get some fresh ones for this week, but it depends on what comes in through the necropsy for this week. No promises. So remember we talked about interlobular septa are well developed in larger species, so you can kind of see them as this kind of cobblestone picture. You can actually see these little individual ovules in the lung in the larger animals, so pretty pronounced in the pig and the cow especially. And then smaller animals, dogs and cats don't have that pronounced lobulation, more solid protein. Yes. Avian lungs, these are brown fixed, and this is the dorsal view, so the ribs and the spine would be right here. They actually kind of intervene with the spaces between the ribs, so and then it's total. So we're looking at a central view. Here's the trachea right here in the forceps. Down here's the lungs. So some lies that the lung cells. Pulmonary congestion, this is the most common postmortem finding in the lung. You can generalize this. This is pretty much true for almost any organ you look at. Congestion is going to be the most common thing. It can be diffuse or regional. So this top image is a picture of a congested lung. It's pretty diffuse. This level of fear is a little less affected, but you can see it's coalescing to diffuse. There's a couple of these light areas that seem less affected, but the whole lung is kind of just a dark red. Pulmonary hemorrhage is your other differential for red discoloration of the lung, and this is going to have patchier, normally local distribution. So differentiating congestion from hemorrhage. Hemorrhage has a lot of causes. Is there anything in the history or the necropsy that will cause you to be more specific of hemorrhage somewhere else in the body going that would put you more for hemorrhage, whereas if it's just the lungs are just kind of dark red all over, but there's not really anything else that's much more likely to be pulmonary. Hydrostatic congestion, this is not a lesion. We talked about our mortis in GenPath. Is pooling of blood, liver mortis, pooling of blood on the downside after death. So your heart stops beating, your blood just kind of settles wherever it is, and usually it makes this very unilateral pattern in animals. One lung looks dark red, one lung looks light pink. This is not a unilateral pneumonia. This is hydrostatic. Fluid imbalance. So, one other thing I would say about lies, the lung cells. So the reason I call this lesions and lies is you really have to feel the lungs to know what's going on with them. It's really difficult to just look at PowerPoint slides without feeling them. Like I'm going to tell you to feel them with your eyes, but like you just felt like it's in 2 lungs in your life at this point. So I understand it's really difficult, but there's always going to be a texture change associated when there's a lesion. Perhaps not with hemorrhage, but when you're trying to differentiate pneumonia, especially, the lungs are going to be firm. So if the lungs look like this and you think they look abnormal, you got to feel them to double check. And the way you fondle a lung is very specific. So my hand is going to be a lung lobe right here. I'm going to take your fingers like this and just gently let it slide through your fingers, and you're feeling for little air bubbles popping. Crepitus. Feels like little Rice Krispies. So that's the normal air-filled alveoli. You're squishing them closed and they're popping back open. So that's normal. A normal healthy lung should have lots of little bubbles like that. You can the lung should be overall pretty soft. It should not have any firm areas. It should be pretty just uniform, soft, fluffy, and little popping bubbles. That's normal lung. If it looks weird, but it feels like that, it's probably not a lesion. It's probably just congestion. Lungs are probably fine. Remember that the lungs are a massive vascular bed. So the amount of blood that's in your lungs when you die can be pretty highly variable. Depends a lot on the state of the animal. There's lots of things happening. So lungs can be really pale, sort of really dark. So Okay, so pulmonary edema, these lungs are going to be very wet, heavy. So you might still feel some crepitus if there's still air in there, but a lot of the alveoli are going to be filled with fluid. So you will not be able to feel as many air bubbles. If you look at this picture, this is a good one to feel with your eyes because see how it's glistening all around the edges? This is wet. This is a wet lung. Soggy. Another thing, a lesion or a body, you guys should always approach it like a crime scene. You have a suspect, but then you always want to look for evidence to confirm if you got the right suspect. So I'm going to talk about confirmatory evidence. So confirmatory evidence that you've got pulmonary edema is foam in the trachea, because the way you get foam is air plus water. Air lives in the lung normally. Add water, pulmonary edema, you get foam in the trachea. This does get a little bit complicated because pulmonary edema is really, really common in just animals that died for literally any reason. So euthanasia, died naturally. Pulmonary edema is just kind of a part of dying. So some degree of that is going to almost always be present in any biopsy you do. And then the converse of fluid overload would be hypoperfusion and hypoxia. So that can be due to things like right heart failure, pulmonary hypertension, the lung is just not getting enough blood flow. Okay, so pulmonary edema, there's a couple different places it can localize. The one we are most concerned with is this alveolar edema, where fluid is actually filling those alveolar spaces. So that's taking up your gas exchange. You're not going to be able to breathe. You get enough of that in the lung. Contrasted to interstitial edema, where the alveoli are still air-filled, but fluid is accumulating in the interstitial spaces and often very prominently in these interlobular septa. So along with edema, it really, really highlights these septa. See how they're all expanded? So these are those defining borders between those lobules that are being highlighted. So that's interstitial edema. Animal can still breathe unless there's other things going on. Here's what that looks like on histo. Here's a normal lung. All the white is airspace. So you can see the lung tissue itself is pretty limpy. These are all the alveolar membranes. Here's all the alveoli, blood in there. And then with pulmonary edema, the pink things are protein. So this is a high protein fluid that's now filling the alveoli. You can still pick out these nice thin little septa and following the little dots and nuclei, but all the breathing space of this lung is filled with fluid. Okay, so pulmonary edema, something added to the lung. Atelectasis, something lost from the lung. Breaking this down for you, ectasia, do you guys know that phase word yet? Means dilation. So like an ectatic tubule is a dilated tubule. Addle is, it's like messed up. So inappropriate or incomplete ectasia of the lungs. So that means your lung normally expands when you breathe, but if it's atelectatic, you don't get ectasia that's normal for breathing, right? So atelectasis is loss of air from the lung and collapse of the alveoli. There's a couple of specific causes. So airway obstruction. If you've got an obstruction here on the main stem bronchus, eventually you're going to absorb the air that's in here. And if you're not getting new air in, the lung cannot expand, right? So that's going to be become atelectatic. Compression from outside of the lung that prevents the lung from expanding spatially. So any kind of exudate in the chest cavity, pleural effusions, any kind of mass effect, diaphragmatic hernia where your GI organs actually come up into your chest cavity and it's a space occupying effect. You can't expand your lungs. And then a couple of special cases. So pneumothorax, remember the way you breathe is by, you have a negative pressure constantly in your thoracic cavity. When those muscles pull open, it actually sucks air into your lungs, right? So you're breathing by expanding your chest, and if that action pulls the air into your lungs aren't actually doing any work to breathe, right? It's almost. So if you lose that negative pressure in there, the lung just collapses because that negative pressure is the only thing that's holding your lung open to fill your chest cavity. So pneumothorax, any compromise to the chest cavity that allows air in there is going to cause collapse of the lung. And then in the case of fetuses and premature babies, abnormal or inadequate surfactant prevents those alveoli from opening fully because of the increased surface tension. And an important note about fetal atelectasis is this can be really useful for differentiating in abortion cases. Was this a stillbirth or a neonatal death? Was it alive, born alive, and then died, or did it die in utero? So an animal that came out and took a breath, its lungs are going to have some air in there, right? So they're going to float in liquid in formalin. An animal that never took a breath, there's no air in the lungs, they're not going to be inflated. It's going to be diffuse atelectasis, and they're going to sink like a rock. And there is no air. There will be no Rice Krispie bubbles, no air. Animals never took a breath. So that can be really helpful for differentiating what you're dealing with abortion causes. When are the animals really dying? A lot of times the producer, they don't know, or they'll give you kind of non-specific information. I found it dead. I don't know if it was ever alive. Okay, so appearance of atelectasis. Remember, we've lost something, so the tissue is going to be shrunken and smaller and firmer than the normal. So this is a really good example. So this pink stuff here, this is normal lung tissue. Normal. And then you see this contour here, how all the red is kind of sunken in and smaller. This is all atelectasis, all this dark red. Zooming out a little bit to this image. Here's the atelectatic tissue. You can see it's shrunken. This pink stuff is more normal lung, and it's more inflated, expanded. All of this atelectasis. Here is a, I believe, a fold. So this was a neonatal death in utero, and this is diffuse atelectasis. So these are lungs that never took a breath. They're diffusely dark red. There is no air in them. Respiratory evidence. Check and see if it sinks in formalin. All water. All right, emphysema. So this one's kind of tricky because it's not really a gain or loss. I guess it's kind of a gain of air. But what happens is you get rupture of those alveolar septa, and those spaces coalesce into big careful spaces. So normally, here's all your alveoli, right? All these little bright bubbles. Emphysema, you get breakdown of these septa in multiple areas, and you end up with a big bulla. So the importance of this is you've lost a lot of surface area from breathing, right? So you still have respiratory capacity, but this is going to reduce it, especially if this lesion is extensive at all. So grossly, this looks like visibly enlarged air spaces. A lot of times you can actually see little bubbles in the lung. So this is a cat that had asthma, I believe. And you can see all these little bubbles here. These are now like a single giant alveolus that's visible to the naked eye. That's what these bubbles are, because they've all are. A note about alveolar versus interstitial. So when I say emphysema, I'm referring to this alveolar emphysema. You can also get interstitial emphysema, which is similar to interstitial edema. It's in those intralobular septa, very common in large animals, especially that have any degree of dyspnea. They actually push air. They're breathing so hard and doing so much work that they're actually forcing air into those intralobular septa. So it'll be emphysema here in these spaces, but not in the parenchyma. So that type of emphysema is much more common in animals. True or alveolar emphysema, these lesions here are quite uncommon in animals, but they're very important in humans. Smokers get this, you destroy enough septa and you get emphysema. That's how that works. And then another possible consequence of this is these can eventually rupture and give you a normal pneumothorax. So here's what that looks like. Again, alveolar is within the parenchyma, so these are actually large ampulla here. Versus interstitial, the parenchyma is normal, but the intraocular septa have all these bubbles, and that's extremely common in large animals, especially cow. Not super significant, very significant. Not very common. Very. Yeah.
So you said the alveolar one is more common in humans. We don't really see it.
Very uncommon in animals.
What about for like dogs and cats that do not have lobulated lungs?
Still very uncommon. Yeah. So, right, the reason we see it in large animals is because they have that in pocket space. Yeah, not super common. So, in order to get this, you need to smoke a lot of cigarettes, right? You need to have something that is destroying your alveolar septa. So, the times that I've seen it in animals, it's been in rabbits. Rabbits are pretty much the only animal that gets this as a spontaneous lesion. And it's often secondary to a severe pneumonia from pastoral metosida snuffles, the other rabbit. I've seen it occasionally in, remember I said this is a cat with asthma. So asthma can involve some destruction of alveoli. You can also see it as a terminal finding. So animals with severe respiratory distress, again, the work of breathing can occasionally hurt those things and you'll get a lot, but that's often usually localized and secondary, not as a primary disease problem.